Good morning, everyone. Today we're going to welcome Mrs. Anna Daniel. She's going to be speaking to us on what it's like to be a radiation therapist. She'll share what her education has entailed, any additional training she's obtained, also what are some highs and lows with her daily work routine. Also, how has COVID-19 impacted her work style? And any other tidbits of information you all want to ask, please feel free to do so on the chat box. I ask that you mute all lines. Once again, thank you, Anna, for joining us.
You're welcome, and I'm ready to get started. So I obviously am going to be talking about radiation therapy, and I'm going to get started. Here we go. My name is Anna Daniel. I work at Catherine O'Connor Cancer Center here at Citizens Medical Center in Victoria, Texas. I have my, can you hear me? I have my bachelor's in radiation therapy from Texas State University. And right there is a picture of me at work making an electron block for one of my patients. It's a very rewarding field to be in. I mean, how many of you know someone who's had cancer? I'm sure quite a few of you. To be a part of their healing process, survival, and recovery can be one of the most rewarding gifts in the world. In the picture to the right, that's me and our treatment room. And the lady in the green shirt is my mother, who was diagnosed a year ago. She went through surgery, chemo, and of course, radiation therapy. To the left is one of my coworkers. Her sister had breast cancer, and she's a survivor. And the one on the very left is another coworker of mine, and her dad actually passed away from cancer. So it's affected a lot of us in many ways. Radiation therapists, we are a key member of the professional team, and we use various forms of radiation to treat cancer patients. Radiation therapy may be used alone or in combination with surgery or chemotherapy, and is the treatment of choice for cure in many cancers. Again, to the right is our Edge machine that we got a couple years ago. There's many benefits to radiation therapy. I know a lot of y'all as nurses, there are a bunch of nurses and they work nights and weekends and 12-hour shifts, and in radiation therapy, we rarely work weekends. I'm personally on call every 6 to 7 weeks, and mainly that's for emergencies. It's got great pay. We work Monday through Friday, 8 to 5 for the most part. And of course, one of the major benefits is we save lives every day. So now I'm going to talk about kind of the day-to-day in radiation therapy. When our patients come in, this is kind of the steps that they go through. So our patient comes in and has the consult with the doctor. The doctor then schedules the patient to have a simulation to prepare them for their daily treatment. The simulation consists of a CT scan, which you can see, that's our CT scanner on the right. It's also a PET machine. And this is done along with marking on their skin, using different immobilization devices for positioning, and different breathing techniques to establish positioning for day-to-day treatments. It's kind of the beginning process. So then this scan is sent to the dosimetrist, where the doctor, dosimetrist, and physics plan their treatment using specific angles and beam shapes to kill these tumor cells while avoiding critical structures of the body. We obviously want to kill all these little tumor cells or the tumor that's in the body and not kill the good cells. After the treatment plan is done, the patient then comes back to have what we call a verification simulation, and then can start their treatments. This verification simulation, or VS, is performed to verify that everything that they've done on the computer systems in dosimetry is actually matching what we're doing in the room. Angles, measurements, their alignment, and breathing techniques are all things that we check during this time before we can start treatment. Again, here's our Edge machine to the right, and you can see we use lasers. There's little lights that are in the top of the top of the system that we use with, has like little ruler systems in there that we use for measurements. We check a lot of things on this day before they can start their treatment. So these are some requirements to get in the field of radiation therapy. I, in particular, went to Texas State. I know there aren't very many places to get a bachelor's in radiation therapy here in Texas. I know you can get a certificate at a couple different places. Then again, there's only about 5, I think, places that you can get either a certificate or a bachelor's in radiation therapy. So I'm going to talk about Texas State because it's one of the main ones. Specifically at Texas State, you must have a science GPA of 3.0 or higher with only 1 repeat on a course. You can't keep repeating these courses. They want you to get it the first time or maybe the second time, and if not, that's it. So you need 2 years of a foreign language in high school. If not, then you need 6 to 8 hours of the same foreign language. You must have an overall GPA of 2.75 or higher. I also listed a bunch of prereqs before you can get in the program, and this takes at least around 2 years to do a lot of these prereqs. There's more, this is just a few, but obviously you can see there's a lot of anatomy, biology, physics, math, and chemistry. So you probably need to like most of those classes. You also need to complete an application packet. You need 3 reference letters and a career goals statement, 3 continuous days of observation hours at a therapy clinic. You'll have to go through an interview process with the admission committee, and you have to have a clear record, no felonies. And this is another requirement from the American Disabilities Act technical standards. This is pretty important because we use these in a day-to-day basis with all of our patients. You must be able to communicate in a clear and conscious manner to patients and personnel. You must be able to read and apply appropriate instructions in patient charts, notes, and records. We record everything on a day-to-day basis. You must lift 30 pounds of weight from the floor to shoulder height, be able to move immobile patients from a stretcher to our treatment couch or table, push a patient in a standard wheelchair, have good strength in both upper extremities and obviously good body mechanics, reach overhead up to 6 feet off the floor. You must see in dim lighting. We have to turn our lights on and off all the time to see our lasers in the room. Visually monitor patients via video monitors and audio monitors, distinguish equipment and background sounds, and hear a variety of pitches, and utilize a keyboard to input data. To the right, you can see this is where we're at. A lot of the time, if we're not in the room with the patient, we're always looking at the patient using these, as you can see, the little 2 smaller screens are our video monitors, and they're also audio monitors. And we can move our cameras to the left, to the right. We can zoom in and out, make sure the table's not getting close to the patient, make sure the patient's not moving. We're nonstop looking at these cameras. Okay, now I'm going to show y'all a little video that is very good.
My name is Ashley Patino, and I'm a radiation therapy student at Texas State University. A radiation therapist uses ionizing radiation-producing equipment that delivers therapeutic doses of radiation to treat cancer patients. They can do anything between treatment planning, treatment delivery, and monitoring side effects. Cancer has always been a part of my life. Breast cancer runs in my family, and that's what got me interested in the field and patient care. When people hear the word cancer, they think of so many negative thoughts, but I think of hope. A few qualities that makes a good radiation therapist would be detail-oriented. Some of the cancer treatment plans have a millimeter margin between cancerous tissue and healthy tissue. So you have to be very focused on patient safety. Some other good qualities would be good communication skills, being empathetic, and very observant. One challenge would be the advancing technology. This is a very high-tech, high-touch profession. So radiation therapists have to keep up with technology and patient care. My favorite part about the program is the clinical rotations. Every semester we get to go to a different cancer center, and that's where I get my hands-on training and I get patient care interaction. After I graduate with a bachelor's degree in radiation therapy, I could go for my master's as a physician assistant, or I can get a certificate in medical dosimetry, or I can go for my doctoral degree as a radiation oncologist. Radiation therapists see the patient on a daily basis, and they guide them through their cancer treatment all the way until they're cancer-free. So radiation therapists really get to build an emotional connection and support and motivate the patient throughout their treatments. Seeing a patient complete their treatment and being cancer-free warms my heart, and I love that I made an impact in their life, and that's how I found my passion.
Okay, so is there any questions? Let's see.
Let's see, Anna, there's some here. What exactly is an electron block and what is it used for?
So we use different types of radiation to treat different types of cancer. We use electrons and photons, and we use different energies. Different energies go, we use electrons to treat skincare patients. That means, it's not going to go as deep into the tissue as a photon, which is what we would treat lung patients or breast cancer patients with. So we use those electron blocks, and we actually can draw where we want the radiation to go and where we don't want it to go.
And for an edge machine, how does that work and what does that, how is it utilized?
An edge machine is what we use for all of our treatments, pretty much. We have that in an IX, and what it is it's a linear accelerator. And I don't know if I can get back to that picture so I can kind of explain to you, but the top part of the machine is where it comes out of. Let me show you. So can you see my picture?
Yes, we can.
Okay, here is where the radiation comes out of. And like I said, we can use this table, can move up and down and side to side. And so we move the patients to, if you can see here where these lasers meet, it's called an isocenter. It's very hard to explain, but we try to put the tumor that's inside the patient in this isocenter where all these lasers meet. And then the radiation actually comes out of the top of this machine and into the patient, and it's all calculated to the depth that it's supposed to go to kill those cancer cells.
Some questions we have about diversity and inclusion. You had shown some images of you and your coworkers and all were female. How inclusive is the role for males?
We actually do have a male. His name is George, and he's absolutely wonderful. He just wasn't in that picture. So what we do is we have 2 different linear accelerators that we work on. And then we have that other room that we do our CT simulations on. And at the time, the 2 that were beside my mom were actually on the edge. And I was just in there helping because, of course, it was my mother. And George was on the other machine. So we do have males. In my class in particular, we graduated with 13 people. And there were 4 males, so obviously there were more females. But there are males that choose to do this profession, and they're absolutely wonderful.
Now, what about somebody with a disability? If they are diagnosed, are there any modifications that could be implemented to help with the role?
As far as a patient?
Somebody wants to seek that as a career, but they themselves have a disability.
So I'm sure as long as they can fulfill all the requirements, it's just a very hands-on, you're on your feet, you're helping move patients over. We have a lot of stretcher patients that it takes, sometimes we have to get someone in the room to come help us move them from their stretcher to our couch. Our couches are very hard and narrow for the radiation to be able to go through. They're made of carbon fiber. So to get them, over. You would just have to be able to fulfill all those requirements by the Disabilities Act.
And what about CEUs? How many CEUs do you need a year? And does the facility help with payments of that?
So unfortunately, my facility does not help as much. There are a couple that you can take a year that they do help. I'm a member, and most radiation therapists are members of this, but it's called an ASRT. And they send you, we're supposed to get 24 every 2 years. You do have to get your CEs, like I said, every 2 years, but they send you booklets with questions and answers, and you send those in after you take a mini test from reading those online. It's very simple. It's all online. You've got it in front of you. Fill it out, answer it, and you send those in, and that kind of helps teach you. You do have to get a couple, like 3 hours of like a instructor-based CE as well. But they're easy to find, especially once you get in the field. There's lots of places you can get them from.
Is your license transferable from state to state?
So I know that most states, because you take a test at the end, and I think that test is good for most states, but there are some states that you have to actually take a certain test for that state. But other than that, I think it is. I can't remember exactly which states it is, but there are a few that you would have to take if you were to move, their state test.
And can you explain the difference, or is this common in your field, of staff nursing versus temp or agency nursing? Excuse me, not nursing, but radiation therapy.
So at our particular facility, are you talking about PRN?
Yes, ma'am. Those who travel versus those who are permanent employees.
So in our particular, here in Victoria, it's so small. We really don't have anyone that's, PRN. Every now and then, we've had a doctor leave or something, and they've had someone come in for PRN. But as far as our therapist, we really don't. But I do know a lot of facilities, when I was going to school, had PRN radiation therapists, and they would go from New Braunfels to San Antonio to Austin, just because all of those little cities are so close. But they do a lot of the PRN there, but not particularly here in Victoria. There's only one radiation therapist center, so we really don't do that.
Now, what extra classes or extracurricular activities do you suggest a student get involved with during their high school years if they want to seek this as a career?
As far as high school, like I said before, I knew I wanted to go in the science field, so I just try to take things that would help you. There was a pharmacy class, and it kind of helped you with the words, anything that'll help you in the medical field in general, can do that for you. Any science classes, any extra chemistry classes, anything like that. But they don't require this, and I can't remember what it was, but I took it and I was really glad I did. And it just kind of gives you prefixes for different prescriptions, just things like that can help you in the future understand kind of what you're learning. Anything in that kind of background would help you in these classes, because there are so many chemistry, biologies, anatomies, and math classes. Any kind of, fundamental classes like that can really help.
Does your facility offer any internship opportunities, whether they're paid or unpaid, or volunteer opportunities for high school students?
No, unfortunately, we don't do anything like that, but we have had many students come in for their observation hours. And we've also had a couple actual Texas State students come in and do their clinical hours there as a part of our facility.
One last question. What words of advice or words of wisdom would you have for a high school student wanting to get into this role, just to ensure that they do not lose sight of the goal?
So to get in this particular field, you have to be very dedicated. You've got to want to do good in your classes, go the extra mile. I would stay after. I had some pretty difficult chemistry classes. You stay after, make sure you get good grades, and you have to be very motivated. You also need to have the passion for it because it's a very emotional field to be in. It's wonderful, rewarding, but it is emotional. These, you get very close to your patients. You see some of these patients 30 to 40 days in a row, and they're going through so much. So, being empathetic, like, dedicated, wanting to make a difference is all kind of what goes in hand with this field.
Thank you so much, Anna. Does anyone on the call have any questions? If you think of anything and you want to ask at a later date and time, please feel free to email me or reach out and we can forward those questions along. Once again, we thank you all for connecting with us. Thank you, Anna, for presenting this great info. We hope you all stay safe and stay healthy, and you all have a great day.
Bye, thank you.